A lot of people have been having a little fun lately in the name of a very serious topic. In fact, you may have seen Katie Couric take Jimmy Kimmel for his first colonoscopy. The reason is simple but important, right? Colorectal cancer, the third most common cancer diagnosis for both men and women in the U.S. And much of finding a cure is about raising awareness. So today, my guest helping us get to the bottom of it all, pun intended here, Carlene Taylor and Dr. William Wise are here for Colorectal Cancer Awareness Month. So I want to thank you both for being with us.
Good morning.
Thank you. Good morning.
So Carlene, you have been a real vocal advocate for colorectal cancer awareness and for very personal reasons. So just kind of bring us up to date. Tell us a little bit about both your son and your friend, unfortunately, in this situation.
Okay, well, in 2004, I had a really good friend and sorority sister from Ohio State. She had 4 boys. I had 4 boys. She ended up with colorectal cancer. And I felt, I sort of put myself in her place as to how would I handle it if I had cancer and I still had my 4 kids to raise. So I promised her I would do everything I could to try to raise awareness for this disease, that it does happen in people under 50. I started a race for Hope Derriere Dash, which will be October 14th this year. And very sadly, Peggy passed away 3 weeks before that first race. But it is continuing to raise money, to raise awareness so that we can let people know that colon cancer does occur in people under 50.
And then it then happened to your son as an example of that. So it is not just age as a factor, right? And when did your son pass away?
Correct. February of 2016, my 22-year-old son was diagnosed with colorectal cancer. We have no family history. There's nothing in the genetics. And he battled it and passed away at the end of September when he was 23. And it's a huge loss, obviously. And this is happening more and more because young people are experiencing symptoms, but they're being told that they're too young for colorectal cancer.
Right.
And that is the perception that needs to be changed. We need to let the young people know that they need to be in tune with their bodies, and if they feel something's not right, and if they're getting sort of a, you're too young for that type situation, that maybe they need to pursue it a little bit more to make sure that they are indeed okay. Parents need to know so that if their kids come to them and say, hey, you know, this is happening to my stomach, or, you know, maybe I'm constipated, that maybe they need to click on in their mind that, well, let's start looking into this.
Right. All right, and I do want to mention, Dr. Wise, you are with Ohio Health, colon and rectal surgeon, so you obviously deal with this on a daily basis. Let's talk a little bit about some of those maybe symptoms parents should watch for, some of the things that people should be aware of, and now knowing that, you know, it does happen to younger as well as older people.
Well, I think the most common thing is rectal bleeding, and it's one of those things where if a young person comes into your office with rectal bleeding, you tend to think about writing it off to something non-cancerous.
Sure.
So I think that being aware that it could be something more than just hemorrhoids or a fissure or some other benign process is important. So rectal bleeding, a change in bowel habits, sometimes abdominal pain, but sometimes not. Those kinds of things.
Now, if caught early, what kind of treatment happens when somebody is diagnosed with colon cancer?
Well, if caught very early with a colonoscopy, for example, many times it can be treated just with a colonoscopy. If someone has a cancer and a polyp and we're able to find it at a very early stage, many times it can just be removed with that procedure and no surgery is necessary. But even if it's more advanced than that or bigger than can be removed with a colonoscope, surgical therapy is still the mainstay of treatment, but many times it can be a smaller procedure. Many times in patients with rectal cancers, we can do a minimally invasive kind of procedure through the rectum rather than a large operation that had to be done in the past.
So there are options, some less invasive, which is always good to know when you're dealing with that. Makes it a little less scary, maybe, to go in there and get it checked out. Carlene, I do want to talk about, you just got back from Washington, D.C. Tell us about your message to the lawmakers.
Okay, well, I went with an organization called Fight Colorectal Cancer, and hundreds of people all across the United States came in for the last few days. And we met with our Congress people on Tuesday. And our main asks for them, there's a Senate bill and there's a House bill, and it's called Remove Barriers. Because what happens right now is if people on Medicare or Medicaid go in for a colonoscopy, it's covered at 100% as a screening. But if they find a polyp in there and then the polyp needs to be removed, then the person wakes up and they have like a $200, $300, $400, $500 bill because now it's turned into a diagnostic procedure. So what we're trying to do is to remove that barrier so that people that are on limited incomes are not scared to go in and have their colonoscopy. And this will save lives, because if you can get in there, like Dr. Weiss said, get the polyp out, then you have prevented cancer from starting in the person. So that's what we were talking with our lawmakers about. And then one of the other issues was with everything that's going on with the Affordable Care Act, we are just absolutely adamant that funding cannot be cut to the NIH or the DOD, which is the Department of Defense, because there's some research that funnels through that organization, that they have to maintain the funding, because especially in the issue with the under 50 and why this is on the increase, because it's definitely rectal cancers are on the increase, more so rectal primary. And then colon is on the increase as well in people born after 1990. So it's imperative that research is maintained so that we can find out what is happening and why this is happening.
That is it. We need to find a cure. If you want more information, of course, check out the website, ccalliance.org. I thank you both for being here and, of course, for your advocacy for the cause, Carlene.
One more thing, the Levesque Tower is blue right now, and it is blue for Colorectal Cancer Awareness Month. So everybody, when you see that blue tower, it's for those whose lives have been lost, that we remember them, to bring hope to those that are still battling, and for people to take action.
Definitely.
Great.
Take action. All right. Thank you both for being here.
You're welcome. Thank you.